Assalamu alaikum. What is palliative care? Palliative care is a way of giving support to people who have life-limiting illnesses. Teams of professionals aim to support all aspects of a person's well-being, such as physical symptoms, emotional and spiritual needs, as well as support for their loved ones. The goal is to prioritise a person's comfort and dignity and ensure that what matters to them is understood and addressed. This type of care can look and feel very different to medical treatment focusing on cure, where uncomfortable, harsh treatments with heavy burdens of side effects are carried out in the hope of prolonging life. Although palliative care can be provided at any stage of illness, even alongside treatment for reversible medical problems, it also includes end-of-life care for when death is near. Care can be provided in different places such as home or hospital and involves a range of specialists depending on what the person's needs are. During these unprecedented times where a virus has seemingly taken over the world, and it is natural to feel anxious and worried about what the future holds for us and our families. As Muslims, we hold firm in the belief of qadr, destiny. We understand that a person's death is pre-written, but we can do what is in our reach to provide comfort and dignity. When a person is dying, there are a number of different aspects of care that can help to provide ease. An important goal is to help to relieve, as much as possible, troublesome symptoms such as pain or breathlessness if that is important to the person and their family. Clear communication between healthcare workers, the person and relatives is essential so everyone understands what is important for that person and works together for that common goal. Palliative care teams include specialist doctors and nurses as well as spiritual guides. Please be aware that many hospitals have Muslim chaplains who can help to provide Islamic guidance and support, particularly during these times, where if a person is admitted into hospital, family may be in isolation due to the virus and unable to visit. In these circumstances, technology such as video communication may also be used as a means of supporting loved ones, as well as other methods to bring peace to the dying person. We know that the elderly, frail, and those with other illnesses are most at risk of losing their lives with the coronavirus. It is very important that those who fall under these categories share their wishes as early as possible so that if they were to become ill, their choices are taken into consideration during decision-making about what type of medical care they should receive and where. Please speak to your GP if you would like to access this support in the community. In the end, as Muslims, we know that every living soul will meet with death and is on a journey back to Allah subhanahu wa ta'ala. Palliative care aims to make the end of this journey as comfortable as possible.